name is Dr. Michelle Reisner. I am the Director of Geriatrics, Hospice and Palliative Care at CarePoint Health. Community Housecall Providers is a company we started in 2005 when my homebound frail elderly patients, or those patients who were having a hard time getting to the office, were falling through the cracks and landing up in the emergency room. Our patients at home are frail. They may not necessarily be elderly, but they may have Down syndrome, they may be morbidly obese, they may have severe osteoarthritis. It's usually very difficult for families to get them out of the home, and so we send the nurse practitioner into the home.
I am Nancy Reyes, and I am a nurse practitioner with Community Housecall Providers. Many of these patients end up in the emergency room. We don't want these patients in the emergency room. They are much better served in their homes where they're comfortable, where they can have all their needs addressed and met. So nurse practitioners are really well positioned to provide the care for people that are homebound. Being able to prescribe the medications is very important for them. They suffer from multiple chronic illnesses, and they really do depend on these medications to, keep them healthy. We will initially get a medical history from the patient or the significant other or the caregiver. We will do a physical exam. And then we will tailor it to that individual's needs. We may assess them for certain things like depression, dementia. We'll do a specific assessment based on the medical history. Once we're in the home, we can kind of look at the environment to see if there's any safety problems or anything that we need to, refer to other outside resources, maybe Meals on Wheels or homemaker services. So we're looking at all these various aspects of this person's, general health.
We started with just a handful of patients, and we've grown to a fairly large program at this point, servicing Hudson and Bergen County. Probably the most common condition we see at home is a patient with Alzheimer's dementia. As the dementia gets worse, it's very difficult for patients and families to deal with the disease, let alone bring them into a doctor's office, wait for hours, have the patient sit there, get agitated, there's behavioral issues. And so especially for the Alzheimer's patient, that's a huge, big burden of the family's sort of plate. We discuss advanced care options. We do end-of-life care. We have a significant number of patients under our palliative care program, only because we really want to keep them symptom-free.
We do become their providers, and that is something that enables us to develop a relationship with them. We get to know our patients very well. We will address acute problems if needed, even though we will make a visit for maybe 1 month as medically necessary. If something comes up prior to that, they can call us and we can see if we can help them.
We have so many thank you letters. Families are so relieved when we go into the home.
We do a lot of teaching. We actually discuss the diagnosis with our families and the patients. So we really try to help guide them through. And I think that in and of itself is, very rewarding for us, for myself, and I know the other nurse practitioners as well.
If somebody wants to set up a visit with us, just call our number, which is 201-536-9000, or visit communityhousecallproviders.org.